in progress. నువ్వేమన్నా తెచ్చుకున్నావు?
Hi, sir. Good morning.
Yeah, good morning, Venkatesh. Sorry, I said no, there was very heavy rain yesterday with thunderstorms, and there was no power since last night. So when I called them, they said like by 11:30 we will have it. But there is a possibility in between there will be power cuts. Okay,
Yes, sir. Same
but
here, or same issue. Power not there,
but
no.
I yeah, but I hope if the UPS charges, then there won't be problem.
Okay.
But because the UPS is connected to a lot of other systems also.
Okay, sir.
So that's what I was thinking. Like if there is any intermediate power cuts, what should we do?
Okay, sir. Tomorrow we'll continue again. Sir. How much today possible? Almost.
Yeah, yeah, that's what we'll continue today.
Okay.
Okay, can you see my screen?
Ah, it's visible, sir.
So yesterday we discussed on clause 1, clause 2, clause 3, and clause 4.
Yes.
Okay. So clause 4, however, clause 4.2.1, 4.2.2 on control of documents. Okay,
Okay,
I
sir.
will emphasize again after completion of our session. Whatever are
Okay.
important, okay, I will emphasize them again after we complete the total discussion. Which are very, very important, I will discuss with you again.
Okay, sir.
Okay, as I said, if you look at clause 5, it's about management responsibility. Okay. In that clause 5.1 is management commitment. 5.2 is quality policy because quality policy has to be framed by the management. Okay.
Okay.
What is the company policy? Like, I think I have shared you a quality policy in yesterday night. Like quality
Yes.
policy is like what is your policy now and in future. Basically, it talks on two, three things like what you are manufacturing, okay, and what standards you are following. Like you will stick to the standards and regulations. Okay, second thing is uh, about the employees. For employees, what you are doing. Okay, you need to mention your company policy. For employees,
Okay.
we'll be doing continuous training. Wherever there are skills required, we'll be doing training. Okay. And the fourth is on the overall company, I mean, customer satisfaction. Okay. Customer
Yes.
satisfaction is very, very important. So there will be 4, 5 points. If you read your company policy also, these points will be there.
Okay, sir.
So 5.2, as I said, 5.1 is management commitment towards the organization. 5.2 is quality policy. Okay, 5.3 is organization roles, responsibilities, and authorities. Because the
Okay.
company has to designate, okay, roles and responsibilities to the employees in the organization. Who will be the management representative? Who will be the head of QARA? Or who will be the head of R&D? Or who will be the head of finance? Okay. Uh, can you tell me which department in QMS, which department doesn't come under audit? So you have a lot of departments in the organization,
Yes, sir.
but tell me one department which doesn't come under ISO 13485. There is one department.
I think R&D or engineering maintenance.
No. Generally, finance department, finance and accounts. Okay. It won't come under ISO 13485. It will be separate, audited by the other, like the bank employees or the bank persons, they will audit.
Okay.
So in ISO 13485, finance and accounts won't come. The marketing will come, R&D will come, engineering will come, maintenance will come, even housekeeping will come.
Yes, sir.
Okay, but not the finance. So here what we'll do is in 5.3, the management assigns organization roles. What are your roles, responsibilities, and authorities? Okay, to individuals. Like then 5.4 is planning. Okay, how the uh, management does the planning of the activities in the organization. Okay, in this you'll have quality objectives. I told you these are very important. I said quality policy is important, quality manual is important, quality objectives are important. See, quality manual we have seen in class 4. Okay, quality policy comes in class 5. Quality objectives also come in class 5. Class 5, okay, 5.4, you'll have quality objectives. I'll tell you, I think yesterday I very briefly I discussed like what are the quality objectives. Like I said, like if the rejections are 90%, sorry, if the rejections are 10%, the quality objective of that production department will be to reduce the reduction. Okay, reduce the reduction by 5%. So in 2026 or 2025, the rejection rate is 10%. So his quality objectives in 2026 will be to reduce the rejection rates by 5%. So there will be a lot of quality objectives for each and every department. Okay, then the management also has to finalize the quality management system planning.
Okay.
Okay, and there is responsibility, authority, communication means how the internal communication happens, who is responsible for that.
Okay.
And in this, management representative is very, very important. I think your company also has management representative.
Yes, sir.
Okay, in management representative, there are two important things. What are the responsibilities of the MR What are the authorities of MR? See, you should not get confused with responsibilities and authorities. Okay, I'll tell you what are the difference between responsibilities and authorities. Because only MR will have lot of authorities. Everybody will have responsibilities.
Okay.
But only the MR will have authorities, and sometimes head of QA or head of RA, sometimes they may have authorities. But the authorities of the management representative are very, very important. Okay. And this is very important, section 5.6, that is management review. I discussed it in very short, like what is management review, what are the inputs the management will see. See, management review is undertaken very periodically. Okay, some companies take every 3 months, some companies every 6 months. Okay, if they are big MNCs, they take MR management representatives every year. Okay, annually they take. So in management review, what they will be discussing? Okay, that we'll see what are the points they will discuss. I told you yesterday only what are the points they will discuss. Okay, and
Yes.
this is the practical approach, practical scenarios. Okay, but first we'll see. Just 1 second.
Okay.
I'll switch on my AC. Actually, now it is very hot. Till morning it was fine. Now I'm sweating.
Yes.
Okay. Yeah.
Okay, sir.
The problem is that AC is connected to UPS.
Okay, sir.
So I need to remove that because AC is with UPS, now it consumes a lot of power. I mean, it will empty the UPS.
Yes.
Okay. So if you look at very pragmatically in a bird's eye view, okay, overall, like, don't look at the class. Though I gave here as modules, but these are class only. Okay.
Yes.
See, class 5.1, 5.2, 5.3 talks about leadership and framework. Okay, what is the commitment? Okay, what is the quality policy? What are the organization roles? Are there in 5.1, 5.2, and 5.3. 5.4 and 5.5 talks of planning and execution. Okay,
Yes.
planning and execution means mainly the quality objectives, planning of the QMS, and appointment of management representative will come in 5.4, 5.5. 5.6 is management review. This is very, very important. 5.6. Okay.
Yes.
And in this, I told no quality objectives are very important. Management representative is very important. Quality policy is very important. So we'll see one by one. Okay. What is management commitment? Okay. Top management must provide tangible evidence that the commitment to the QMS that isn't passive requirement, it's an active requirement. What it means is when the auditors, okay, when the auditors come and they audit the management should show that they are committed, okay, tangible means with evidence, okay, with substantial evidence that we have provided the facilities, like we have provided the infrastructure, we have provided the manpower, we have provided the machinery materials, okay, for the manufacture of so and so devices. And we have implemented the QMS, okay, all the class, like from class 1 to class 8, we have implemented the QMS with objective evidence. You know what is meant by objective evidence? What is objective evidence? Objective
It's
evidence is
traceability of
no
data.
evidence is something to show with proof.
Yes.
Okay, there should be a proof. Like, see, if I say I have provided infrastructure, the management say I have provided infrastructure. They have to show this is the infrastructure. Okay, physically they can see the infrastructure, they can see the clean rooms, they can see all departments, QA, QC departments. Okay, then they'll say like, I have provided the manpower. Okay, maybe they may not show all manpower, but all the documents, whatever they have from HR, they will show, see, this is the manpower we have. We have enough manpower to manufacture. This is the QC manpower. Okay, this is the R&D manpower. This is the purchasing. Each department, they have to show manpower. So what I'm trying to say is that you have everything documented objective evidence is there to show that the management has committed to run the unit manufacturing facility as per ISO 13485. Are you getting my point?
Yes, sir.
Okay. So in this, what are the important is they should have quality policy. Okay. Quality objectives are established. I told you quality policy is like a company's policy, like what we are doing now and future what we will be doing. And
Yes.
my commitment to the organization and the employees. Okay. In quality policy, they don't write that I will give daily monthly salary on time. All that won't come. It will be very diplomatically written. Okay. The management is committed. Okay. It starts with this. The management is committed to provide infrastructure, okay, manpower, all the facilities, okay, for the manufacture of so and so devices like your insulin pens or accessories of the highest quality and standard. That will be point one. You can see all quality policies will have this very general. Okay. Second is the management is committed, okay, to follow all the regulations and update to the regulations of every specific country where we are marketing. Okay, wherever they are marketing, they have to follow the regulations.
Yes.
First is provide all the facilities for effective functioning of QMS, ISO 1348. Second is to follow the regulations. Okay, and the third is regarding the manpower. Okay, we will provide enough manpower and we will also provide periodic training to the manpower, okay, as and when necessary, based on the skills associated with the manpower. See, manpower training is very, very important. Okay, and the fourth one will be like, of course, I shared one quality policy in your WhatsApp. You can check it.
Okay.
The fourth one is like we our company is committed to produce or to manufacture, okay, best or highest quality standard devices and products, okay, as as per these regulations to be benchmarked with any other company. So overall it means that we are committing to produce the best quality products, okay, and patient safety. And the last one always will be we adhere to the customer requirements and customer satisfaction. See, these are 5 points any quality policy will have. You look at any company quality policy. These are they write it in different way, but basically they touch upon these 5 points. One is we commit to implementing ISO 13485 effectively. Okay. The second one is we'll follow the regulations of the countries, medical device regulations of the countries. The third one is we'll take care of the manpower and the training. Okay. And the fourth one is we'll produce uh, medical devices of highest quality. Okay. And patient safety. The fifth one is customer satisfaction. Okay, customer commitment and satisfaction. These are the five which in every quality policy you will see. Okay. So in 5.1 you'll have quality policy. And what is the other commitment? First, they need to write the quality policy and objectives. I'll tell you what the objectives are. Ensure availability of resources. That is the commitment. What are resources? I told you yesterday, what are the resources?
Infrastructure,
Infrastructure,
human resource,
infrastructure, manpower,
manpower, machine, human resource.
machines,
Yes.
yeah, human resources, infrastructure, okay, and machinery and
Machine,
material.
material, method.
Yeah. So all that they need to provide. That is the management responsibility and commitment. Okay. And ensure management reviews are conducted. So
Okay.
the management has to conduct management reviews. Okay, based on, say, if it is an SME, small company like MSME, they conduct management reviews every month. Or some companies, big companies, they conduct every 6 months. Okay.
Okay.
So, what is the purpose of management review? The purpose of management review is to understand what are the activities that are happening in the organization. Are there any problems with this? Or is it everything happening smoothly? Okay. And are there any deficiencies that are there in the company? Are any manpower is required or machinery is required? What's happening to the device? Okay, complaints, customer feedbacks, okay, audits. Whether everything is happening, the management has to conduct reviews. If they are not conducting management reviews, see, the first document any auditor will see after coming to the company is the first one is the management review because it shows like how the company is working. If there are no management review meetings, okay, it means that the management is not taking care of the company. The second document they look is the internal audits, whether periodic internal audits are happening or not. If the internal audits are not happening, which means that the QMS, okay, the organization QMS is not functioning properly.
Okay.
Okay. And the third important document they see is the quality objectives, whether there is any improvement, because every company should have continual improvement. From past year to next year, they should show some improvement. Okay. Is there any improvement there? Okay, it is based on quality objectives. Then, of course, quality manual is very, very important. So, the quality manual, quality objectives, quality policy, management reviews, okay, uh, management reviews, internal audits, and most importantly, what are the complaints that are received in that year? Whether they are very serious complaints or they are non-serious complaints. And for that complaints, have you done any COPPA? How you handle the complaints? Is there any corrective and preventive action done? So these are some very, very important things. There will be 10, 15 things where the auditors focus more. Okay.
Yes.
Yes. This also includes management review meetings and ensure regulatory and customer requirements are met. This is what I said. Any company has to follow the regulations, that country regulations. Suppose I am manufacturing devices in India as per IMDR, Indian regulations. Okay. The management has to see that we are following the we are following the Indian regulations. If we are not following the Indian regulations, then there will be a problem. Suppose I am manufacturing devices as required for Europe. I should follow European regulations. So the management see that the regulations are met. Regulations, you ensure that the regulations are met and customer requirements are taken care of. Okay, if there are any customer requirements, like suppose if you are doing OEM or if you are manufacturing devices for other customers on OBL or own brand labeling, on loan license or on OEM, you must see that the customer requirements are taken care of. That is the commitment of the management. Okay, these points cover the management commitment. Mainly the quality policy objectives are established, availability of resources, conducting management reviews, okay, ensuring regulatory customer requirements are met. Okay, if these are not followed by the management, then you will get an NC. Okay. Then coming to clause 5.2, this is 5.1, management commit.
So one doubt.
5.2 is,
Hello.
yeah,
Sir, just I have one more doubt. Like deviation and NC both are same, or like
no, no,
some
deviation
function
is different. Deviation is
functional?
different.
Uh,
Deviation is different.
okay.
Okay, NC is, see, deviation is when you have some value, okay, which can be quantified. Suppose I have some technical specification, I have a value of 5.2.
Yes.
Okay, and I am deviating from that to 4. That
Yes.
is deviation.
Okay.
Non-compliance is something where you don't follow the procedure or you don't follow the system.
Okay.
Okay, that is non-compliance. See, non-compliances always results in non-conformities.
Okay.
Okay, see, non-compliances, as I said, no, when you don't follow a process or a system, it will lead to non-compliance. I have an SOP, I'm not following it. Okay,
Uh,
that will become a non-compliance. But
that
when you are not following the SOP and the system, okay, and the resultant products what you get, the devices what you get will be non-conformities. Okay, the devices will have non-conformities or they will be rejected products. So process, if you don't follow the system and the process, whether it's SOP or STP or QSP, if you don't follow them, it will become a non-compliance, and a non-compliance will result in non-conformities in the devices. Okay.
no, sir. Actually, like we are performing one test, some
Hmm.
calibration or some test, anything. It's everything is mentioned in SOP and STP. Uh,
Hmm.
so if in that one of any step missed, it go under deviation. So they
Yeah,
are
that,
uh,
see,
uh,
that is deviation. In calibrations, you will have deviation.
no, so even the any test calibration, okay, any test is performing, in that any one test parameter missed,
Yeah.
in that we will initiate the deviation. Approved procedure and STP are not followed, so they will take a QMS. But in that matter, NC where it will come in the category, like
Yeah, if there are deviations, that will result in NC.
okay, okay,
They are not same. Deviations will result in NC.
okay,
Deviation and NC is not the same. If you are deviating from what is written, Or if you are deviating from the process that okay, in calibration you need to do so and so, so you are deviating from that, that will become an NC.
Okay.
If you do, that is non-compliance. If you continue doing non-compliances, okay, it will result in non-conformities.
Okay.
Okay. See, the quality policy I already discussed, like suitability that the company, I mean, the management has to tell that we are producing medical devices and our manufacturing unit has ISO 13485 to produce medical devices and we are following the QMS effectively. That is suitability of the company to manufacture medical devices, okay, and addressing the patient safety or of good quality or patient safety. Objectives framework. It provides framework of getting quality objectives. Say again, I am telling quality objectives are very important, which means that we commit to continuous improvement. This is what I said. There should be continuous improvement in all key processes. Okay, suppose if you have some NCs this year, your NCs should reduce next year. Okay, non-compliances. And if you have rejection rates, if you have complaints should reduce. You can't have complaints every year same or more complaints next year. If there are more complaints next year, what it means? There is something wrong with your system. If there are more rejections, what it means? Then last year, if this year there are more rejections, it means there is some problem with your system or with your process. Okay. And if you have more rejection of raw material, which means there is some problem with your system. And if your devices design and development is failing every time because your devices have to be developed in a span of 3 years or 5 years, but they are taking 7 years, 8 years, which means they are not sticking to the timelines. Okay, which means there is a problem with your R&D. So there is no improvement in your system. Of course, auditors don't take R&D seriously. They seriously take manufacturing, QA, QC, okay, infrastructure, manpower. This they take it very seriously. They won't seriously look into R&D because R&D is basically they work on trial and error method. Sometimes they may fail, sometimes it may be successful. But for R&D also there will be objectives. Okay, this year you need to come out with these devices, or if there is any complaint, you need to redesign the devices. Okay, but that we won't be taken seriously. But the core audit will be done, as I said, on clause 7 and clause 8. Okay, and on clause 6 also. Clause 6 on resource management, they look at clause 7 on design development. They won't inspect design development so much, but mainly on the production planning, realization, okay, then purchasing. Then on clause 8, like monitoring, measurement analysis, how you are doing your customer feedbacks, internal audits, complaints, how you are handling non-conformity products. Okay, all this yesterday I told you like clause 6, 7, 8 are very, very important. Of course, clause 5 is management responsibilities. In that you have very specific things. I said quality policy, quality objectives, management reviews, okay, management commitment, But in India, the problem is the auditors, they won't question the management so much. Okay, they spend just 10-15 minutes with the management, they have a cup of tea and they'll come out. Okay, and the rest should be taken by the management representative has to answer all this. Okay, so that is quality objectives and commitment to the requirements and effectiveness. Okay, whether I am following the regulations, what is my commitment to the customer, or my regulations, what I am following, the QMS, what I am following is effective. Okay, the effectiveness of QMS is very important. How you will know the effectiveness of QMS? How you will understand that your QMS is effective? Can you tell me some inputs to show that the QMS is effective?
Hello, sir.
Yeah,
Just in 2 minutes, sir. One call is there. Mom, just I'll 2 minutes.
okay, fine.
Yes, sir. Sorry, sir.
Yeah, it's okay. So I said quality policy we discussed. Okay, that see, I asked you a question like how to know the QMS is functioning effectively. What you look at? Suppose if you are an auditor, okay, what are the documents you look at to know that the QMS is working effectively or not? Just now I told you.
We are having one skill matrix Excel, sir. So and monthly we are periodic review. Monthly we'll schedule what was the deviation OS QMS happen. We list out. We give to the auditors, and if they are asking any batch, we will collect from raw material to finished product end, including with CFT and QA documents, uh, and we are presenting the with PPT.
No, I'm asking not in your department. I'm asking overall in the company. See, your department is not just the QMS. QMS is the total company, quality management system of the whole company.
Yes.
Okay, how you know that in your company the QMS is functioning or functioning effectively? What documents you will check? I'm not asking about your department, the total company. If you are an auditor, internal auditor, what documents you will ask the company to show to understand whether the QMS is working effectively or not?
Based on kappa.
Okay, one is based on complaints and COPPA.
uh,
If there are more complaints, which means that the company is not running properly, the QMS is not effective.
yes, sir.
Okay, and tell me 4, 5.
uh, and internal audit, external audit, some observation how many gods,
Yeah, okay. Next.
and
I told you like you need to check the management review meetings, whether management review meetings are happening or not. Okay.
okay,
You can look at the rejection trend analysis, whether the rejections okay are increasing or decreasing, product rejections. Okay. And you can look at the non-conformities of each department or overall what are the non-conformities.
okay,
Okay, there is a system to see like whether they are compliant or non-compliant products that are happening. Okay,
okay,
so what I said, 5.1 management commitment, 5.2 is quality policy, 5.3 is organization roles, responsibilities, authorities. This I told you. The management has to, I mean, they have to allocate the responsibilities like who is the head of QA or who is the management representative, okay, under him who is working, or like people will have different companies have different designations. Okay,
yes,
assistant manager QA or manager QA or head QA. Under them, there will be some people working. Okay, this you'll find in organization chart. Every company will have an organization chart under whom you are working, to whom you are reporting. Okay, suppose MR is there, he will be reporting to the CEO or to the director. Head QA will be reporting to the CEO, or head production will be reporting to general manager. General manager will be reporting to the CEO. So there will be organization chart, like how many departments are there, who are the employees in that, how many divisions you have. Okay. So I will share with you how the organization chart looks like.
Okay.
Okay. See, it is not only having appointing people. You are head of this, you are in charge of this, or you are head of sterilization, microbiology, you are head of R&D. Under that, you have some scientists. Not only that, that is first important organizational chart.
Okay.
But the management also need to delegate their job responsibilities. Okay, what is their job responsibility? What job they need to do? Generally, management don't do that. Head of the department tells you what are the job responsibilities. But as per ISO 13485, the management should delegate job responsibilities up to date. Today, what are, not 1 year back, today, what are your job responsibilities? If I ask you, what are your job responsibilities in your company? Okay, there won't be anybody without job responsibilities. Everybody will have some job responsibilities.
Yes, sir.
So that we call JDs, job description or job responsibilities.
Yes, sir.
Okay, that has to be clearly mentioned to the employee or the heads of the employees that this is your job responsibilities or your job description, what you need to do. Okay, that is responsibility.
Yes.
Okay. And first thing what I told, they should appoint people. Okay. In the organization, they should appoint people at different places. Okay, who takes care of the organization in different departments. And the second I told, in the departments, they should tell what are their job responsibilities. They should tell what is their job description.
Okay.
Okay. And the third, they should tell the employees that what are your interactions with the other department. Suppose production is there. Production people interact with QC or QA. Production people interact with purchase. Production people interact with R&D. Okay. And QA interacts with R&D. QA also interacts, regulatory people interact with QA. Okay, QA also interacts with maintenance and sterilization. Okay. QA or production also interacts with the marketing team, like how many devices you want, this much, or in this year, how many products you require, so that they can plan the production. So these process interactions should also be conveyed to the employees that, see, you will be interacting with these departments. Okay, because yesterday I showed you very clearly the process interaction chart. Okay, I showed you a diagram, like say in product realization, how the process interaction happens.
Okay. Yes. Yes.
Design and development, it will go to production, production to class 8 on monitoring, analysis, improvement, resource management to management responsibilities. So there will be a lot of interactions within the organization between departments. So in that, the management should tell, like, what are your process interactions while you are working. You should know what are your interactions with the other departments. Otherwise, there will be a lot of difference between two different departments. They don't understand. Okay, there will be lack of communication between two departments. When there is lack of communication, everything will go wrong. Or one will feel superior than the other, or they may think that I know everything, you don't know anything. It happens in many companies, I know it.
Yes, sir.
Because I worked in shop floor for almost 15 years.
Okay.
Okay, so in the clause 5.3, wherein the management should, point 1, should appoint, okay, or designate people in different positions, okay, like in the organizational chart, who is the head QA RA, or who is the assistant manager, who is the manager, all that. Not only appointing them, they should also point to is, what is point to? They should provide the job description and job responsibilities to them. Okay. First is appointment. Second is providing them their job description and job responsibilities. Otherwise, people can't do everything they like. There should be separate, discrete job work where every individual has to do. It's not that everybody does everything. Okay. So you should have a very specific job responsibilities. What is the third one? What is the third one? Just now I told. Third one is the employee should be told like what are your interactions with the other department. We call them as process interactions. Okay, interactions with other process or other departments. I told you an example like production people should always interact with purchase because they need to take the raw material, how much raw material is required for production, and QA will be monitoring them, like how much material I have taken and how many units they are producing, what is the net production that day and what are the rejections. Okay, the QA is basically the head of the organization. Of course, you have regulatory department. Okay, their work is very different. Okay, and QA also interacts with QC. Of course, QC comes under QA only. QA interacts with maintenance departments. QA interacts with lot of other departments. So you should be able to tell to the employees that these are your process interaction. In the process, to whom you need to interact. It's not like everybody starts interacting with whole of the company. Then it will become a fish market. Okay, there will be specific areas where people interact and communicate. Suppose I want today's production plan. QA will go and ask the production manager, where is the production plan for today? Okay, the production manager will go to the stores, ask the stores manager that today this is our production plan and we need so many raw material of different types. So this is interaction. Are you getting my point?
Yes, sir.
Yeah. So that is 5.3 is organization roles, responsibilities, authorities. Okay. These are all case studies where you can, when audits happen, what the people ask. Okay, 5.4 is planning. Okay, in planning, you'll have mainly the quality objectives. Okay, quality management system planning. Responsibility, authority, and communication. Here you will have, this is different, like we will be talking more here about the management representative. Okay. And 5.6 is very crucial. Management review meetings, we call them as MRMs. So if you look at planning, okay, 5.4 is planning. These are all management responsibilities only. Planning is, first thing is quality objectives. What are the objectives? When you plan something in your QMS, you will give quality objectives, okay, or objectives to every department. Okay. Your quality objectives should be in line with your quality policy. Suppose in quality policy, I say I will produce the best quality devices, okay, and taken care of the patient safety. So, how you will produce quality devices? How you will produce quality devices? It doesn't happen overnight that devices will come out with good quality. There is a process, okay, that works to produce quality devices that are safe and effective for the patient. So to produce quality devices, you should have quality objectives. See, in quality policy, we have defined that we will produce quality products or quality devices for patient safety and effectiveness. That is quality policy of the company. So to fulfill that quality policy, how you will produce quality devices? So you need to have quality objectives. Every department will have quality objectives. So these quality objectives generally will be in line with your quality policy. Say I say like we'll produce quality medical devices. Okay, we look after patient safety. Okay, we will adhere to regulatory requirements of the country, and we'll also have zero non-compliances. Okay, all these are there in quality policy, but how you will meet your quality, what you have mentioned in quality policy, how you will meet them. That's why quality objectives are mentioned, designed by the management. Actually, management doesn't do this. The department only does this, but the credit goes to the management. Okay. So each department, I'll share a document on this, like for every department, what are the quality objectives? Okay. For marketing, what should be quality objective? For R&D, for QA, QC, production, purchasing. Okay. I'll share a document, you go through that. But importantly, what we have to during the audit, the auditors look at important thing. The quality objectives should be measurable or quantified. What you mean by measurable or quantified?
Measurable means the limited of devices need to perform measure dimensions like test quantitative check overall of sum of batches. We need to restrict the like this much of batches we need to check this much of samples number.
No, quality objectives should be, I'll tell you one thing. See, the quality objectives should be smart. What is smart? Okay, you look at
Ac-
here.
yes,
The full form of smart is, okay, in any world over you go, you'll find this word. Quality objectives should be smart means it's not beautiful or something like that. The abbreviation of smart is here. They should be specific. Okay. S means specific. They should be measurable. They should be achievable. A means achievable. They should be relevant.
yes,
Okay. What I'm trying to say is, suppose some people who don't know smart objectives, don't know the definition of smart or abbreviation of smart, they write quality objectives. They write like, they write everything in sentence saying that I will fulfill, okay, I'll do my best to fulfill that the rejection rates will come down.
okay.
Is that smart?
No, no, it's not in technical sound.
It is just a sentence, like it is
Yes,
wording, but it has to be quantified and measurable. You need to mention, you have said, like, okay, the rejection rates, I'll do my best to reduce the rejection rates. So, by how much you want to reduce the rejection rates? By how much? 5% or 10% or 20%? Or you may say, I'll make rejections zero. See, that is what 5% is quantifiable. You need to quantify, okay,
yes,
or quantifiable or measurable. You should be able to measure it. It should not be a general statement like, I'll bring down the rejection rates. That is very general.
yes,
I'll bring down the rejection rates, I'll improve the productivity. No, that is not taken as quality objectives. They should be measurable. How much productivity you'll increase? Okay, how much rejections you'll 5% rejections or 90% productivity you will increase, or you will bring down non-conformities, okay, by 10%. So that is, see, first thing in smart is they should be very specific.
yes,
Okay, we should not be very generalized. Example, reduce non internal manufacturing non-conformities rate. Okay, very specifically is saying I am trying to reduce internal manufacturing non-conformity rate of some components. He is not telling total finished products non-conformities I am going to reduce. He is telling internal some component internal manufacturing non-conformity I am trying to reduce, very specific to the department and very specific to his work. Okay. What work he is doing, he is mentioning it very specifically. Suppose he is preparing some components. He's, he is telling about his components, not about the total device. Because total device is not in his hands. Because there will be a lot of components assembled to form a total device. Total device non-conformities or rejections won't be there in his hands. So at least in the components in internal manufacturing, that is specific and measurable. Measurable means I'm going to reduce it by 10%. Okay, if there is 10% last year. Now I am going to reduce it by 4.2%. Okay. By
Yes.
10% from the current baseline to 4.2%. Earlier it was 10%. From that baseline, I am going to bring it down to 4.2%. That is measurable. You are quantifying with a number. Is not telling that I will reduce it as per my capacity, or I will reduce it, I'll try to reduce it as best as I can. That is not accepted. You have to mention with a number that this much percentage I am going to reduce from previous year. Previous year is 10%. Now I am able to reduce this year by bring it to 4.2%. So first is specific to his work. Internal manufacturing of the components, I am going to very specific. Second is measurable. Third is achievable. This is very important. See, you should give objectives very realistic and which you can really achieve. Don't give objectives which you can't achieve. Suppose don't say that I am going to bring down rejections to 0.
Yes, sir.
So nobody can reduce rejections or rejection rate to 0. Can you achieve 0% rejection? It is impossible anywhere in the world to have 0% rejection. So what you can achieve? Okay, be very relevant. Okay, what you can be, what you can really do, give that number. Don't think like I am on the moon, I can do everything. I can bring productivity 100% or 200%, which is not practical.
Yes.
Okay, mention what is practical. Then relevant. Relevant is to improve overall product conformity and reliability. So relevant means it should be inconsistent with your quality policy. Suppose in quality policy we mentioned 5-6 points. Okay, it is relevant to my organization. See, whatever you do, it should benefit your organization. Suppose if I am reducing rejection rates, it will benefit the organization. Okay, overall the organization benefits. So it should be relevant to your quality policy and relevant to your organization and relevant to the patient safety. So what SMART means here? What is SMART? What is S?
It's specifically measurable,
Specific, measurable,
accurate,
achievable,
relevant.
relevant. Okay. Your quality objectives in whatever department you take. That's why I said I will share an example of quality objectives of how I framed for each department, keeping these SMART objectives, how they are very specific, how they can be measurable, how they can be achievable. See, achievable is very, very important. Some people know, I've seen in many companies, some people, because of their overconfidence, they say that I can achieve this year so that I can get a good increment. I can do this, I can do that. Okay. And finally, at the end of the year, they won't achieve anything. Because when you write the objectives, okay, achievable means it depends on a lot of things. How much time you are working, how much, whether you have the machine or whether you have the manpower, how many people are working. Actually, what is, okay, what is the production, what is happening, whether you have all validated, calibrated machinery. Okay, is everything ready? You have to look into lot of things when you say I can achieve this. Because lot of factors depend upon how you work or how you achieve in a company. It's not a single individual work. You have to work with a team. And as I mentioned, there will be lot of processes, interactions that happens with the team. So if you have confidence, overconfidence, say that I can achieve anything under the sky, and end of the day, after 1 year, he can't achieve anything. So you have to be, that should be specific, measurable, achievable, relevant. Okay. And these are quality objectives. Every department should have the quality objectives.
Sir, achievable means that is it after the action of measurable, or what it's past, any like implementation that is achievable part, like we need to escalate, we need to inform.
See, before you write, see, suppose 2026 April, some companies work by calendar year, January to December. Okay, is their calendar year. 1 year they look at as January to December. Some companies work as financial year from April to March. Okay. Many
Yes.
US companies work on calendar year. Calendar year is January to December.
Yes.
In India, we work through financial year. Financial year means
March.
March to April.
March to April. Yes.
Okay. So in India, what the management asks is, give me your objectives, quality objectives for the next financial year, 2026-27.
Okay.
Okay, before only they will ask. Next year, what you are going to achieve? 26-27. What are your quality objectives? So you need to write your quality objectives, or your department has to write, or your HOD has to provide, or you yourself has to write that my quality objectives for next 1 year will be this. Okay. When you are writing quality objectives, you remember this SMART. Be specific, and it should be measurable, and they should be achievable. You should be able to achieve them. See, if you are not able to achieve, after 27, people will blame you. You wrote so many things that you will achieve that, this, and you haven't achieved anything. So what is really achievable, you should. Sometimes it happens, when I say measurable, suppose my rejection rate is 2%. Okay. Or think that rejection rate is 1%. See, some I have seen, my quality objective for next 1 year on rejection rate will be 1% only. See, last year it is 1%. This year also will be 1%. It is good, like, you can't bring rejection rate less than 1%, because he knows he can't bring down rejection rate less than 1% or 0.5%, because that is not achievable. Because he knows the process, he knows that there will be rejections, there will be non-conformities, there will be deviations. Okay. There will be intrinsic deviations that happens in any production. We call it as CPP, CPK. Okay. And you can apply Six Sigma also.
Yes.
These or like production capacity, CPK, PPK. Okay, it is inherent that there will be some rejections. So if somebody writes, if there are already 1% rejection, if somebody writes that I'll reduce it to 0.1%, which is practically impossible. So that is not achievable. So what he does is he keeps that I'll maintain the same rejection rate, 1%, and see that it doesn't go down or it won't increase to 2% or 3%. Are you getting my point?
Yes, sir. Sure.
Maintaining 1% this year, next year is fine. But he must see that it won't go to 2%, 3% or increase. If rejection rate increases, it is very bad. Because last year it is 1%. Okay, next year also I'll give 1%, which he thinks that it is achievable.
Yes, sir.
But he doesn't say I'll go to 0.1, reduce it to 0.01%, which is not achievable. So sometimes you can manage by saying that whatever is the last objective, I'll keep the same objective this year also because that is achievable. Okay, that is the maximum I can do.
Yes, sir.
Don't say too much like I can bring down rejection to 0, which is not possible. Okay. Okay, maintain. The other is 5.4.2. After quality objectives, this is not so important, but QMS planning is important.
Yes, sir.
Planning includes same documentation what we have seen in clause 4. Okay, change controls, all this. When you are doing some changes in your SOPs or records or in your quality manuals, you need to write a change control form, get it approved, make the changes, inform to all that these changes are made. If there are new changes, you have to train people on the new changes. Okay, and it has to be circulated. The whole document has to be discarded or made absolute. Okay, these are again linked to clause 4.
Yes.
Okay, integrate during changing. If update a process, if you have updated a process or new sterilization method, you must plan the changes to ensure QMS doesn't break. Suppose you have made any changes. So the document changes, training, validation, all that has to be carried out. Okay, if there are changes in the documentation, you need to make change control, all that.
Yes, sir.
Okay, 5.5 again seems to be like something what we have seen in 5.3. Okay, responsibility, authority, internal communication. Of course, these we discussed. Everybody should have a job description, organizational chart. Okay, I'll share one organizational chart. This first comes the chairman, then there will be 1 or 2 CEOs, then there will be general managers, then there will be head of the managers or head of the departments, then you'll have assistant managers. Okay, I mean, every company has their hierarchy of designations. Okay,
Yes.
yeah. And internal communication is very important. How you communicate internally within the organization, whether you send it through mails or whether you send it through notice or keep it in notice board, okay, or you get it signed, you take the signature of everybody, okay. The QMS relies on timely, effective communication. Example, when a significant quality incident occurs, there must be a defined SOP for whom is notified, regulatory affairs, top management. Suppose if something's happen, if there is a complaint that comes in, Okay, you should know to whom we need to notify. If it is a very serious complaint, how is the internal communication, how you will do? Okay, immediately you will notify in a written letter, or if they are not available on an email, to the concerned person, whom you will inform first to the management. This is a serious adverse event, serious complaint happened in that particular hospital, because the management has to be informed in certain important issues, like serious complaints where there could be death or mortality. Okay, then you will also inform it to management representative. He also has to be aware. Then you will inform to QA. Okay, because he is responsible for quality assurance and dispatch of the material, dispatch of the finished goods, because he will sign the final dispatch. Okay, then you need to inform to the production. So few people has to be informed. Those who are there already, you will give a written letter, okay, and ask them everybody to sign that, okay, this serious incident happened and everybody is informed of this incident and aware that there is a death that happened in a particular hospital because of our device. If the management is there, you can give a written letter to the management, or if he is not available, you can call him. See, instead of calling him, better not to give calls. It is always better to send mails, because when you call, you don't have objective evidence. See, if the management says that when you called me, what is the proof that you have called? Maybe you have recorded the call. If you have not recorded it, they say that you never called me, or he may forget. Okay. So for that, you should have an objective evidence. For objective evidence, if he is away, you should send a mail. Okay, if we delete the mail, then it will be there in your inbox. I have sent the mail so and so date. But if he is in the organization, you should give it in a written letter and take the signatures and have two copies of it. One copy you should file it, and one copy you should give to him. Anybody. This is the standard procedure. It may look too bureaucratic, but this is the best. Instead of orally informing, oral information, oral intercommunication is not uh, accepted. Okay, because oral communication doesn't have objective evidence. For objective evidence, you should have a written communication either in hard copy or on the mails. Okay, that is the best. So internal communication is very, very important. Sometimes if it is a mass communication throughout the company, you can keep it in the notice board, but these are not very important. Suppose today half the generator is not working, or the clean rooms will be closed, or tomorrow is holiday, or there is an inspection. Suppose if there are internal audits tomorrow,
Yes.
so you should send an internal notice to all departments that tomorrow there is an internal audit. So and so departments tomorrow, everybody should sign on 29th. Okay, R&D department 30th, purchasing department or stores. So everybody has to sign. Then you will have, and that is important to keep in your records, that you have informed this, conducted this audit, internal audit, because during the external audit, okay, the auditor will ask you where is the circular you have sent for the internal audit, for conducting the internal audit. Okay, where is the proof? Then you have to show that letter that this is how we have conducted. Everybody, head of the departments all signed, and these dates we have conducted the audit.
Yes.
Even in management review meetings, you have to take the signatures of all those who are participating. Okay. In the meetings, that every name, they have to write their name, signature, at what time you are conducting that, what date, because this you need to keep in the file. When the auditor comes in, sir, say this is the management review meeting when we have conducted, these are the attendees, these are present, they have signed it, and this is the MOM, minutes of the meeting. Okay, what we have discussed is these points. Okay, and whatever points we have discussed, these are the outputs. Okay,
Yes, sir.
with timelines, these are the outputs. So that is very important in internal communication. At any cost, you should avoid oral communication.
Yes, sir.
Okay. See, management representative becomes very, very important during the audits. Otherwise, nobody cares the management representative. Okay. And management representative, actually, I find very strange in India, Indian manufacturing companies. See, a management representative should have basic understanding on all departments.
Yes, sir.
Okay, whether it's QA, RA, or production or maintenance, how to manage, okay, the organization. He should have basic understanding, regulatory understanding, quality understanding, maintenance, production, purchasing. Generally, QA person, the head of QA will have knowledge on most of the things. Okay, it's already, I mean, I feel like the head of QA should be appointed as management representative. But in India, what happens is the management representative will be a person who is very close to the management. He may not know anything. Okay, he is the one who keeps passing information to the management, like what is happening in the company, who is working, who is not working. He is like, he could be a relative of the management, or just there will be some people in the company who are just keep buttering the management, okay, or close to the management, but they are not eligible to be the management representative. I may be critical or I may be wrong, but I don't like such kind of people to be management representatives. Management representative should have overall idea of what the QMS is, regulatory knowledge, knowledge of the department, how to run the QMS, okay, and how to handle any emergency situations. Emergency situations, suppose there is some power cut, okay, generator is not working, power cut is there. Sometimes there is a lack of material, raw material. How to handle them? Sometimes things get delayed. How to handle them? Instead of showing reasons, shouting, okay, blaming the employees, you should be intelligent to resolve the problems. Okay, if you want to resolve the problem, you should be having knowledge on that, and you should be also having experience working in the shop floor. Okay, it's not that because you are a relative of the some management director, or if you are what you call, if you are just buttering the management and just passing useless information to the management, they won't serve as management representatives, because management representative has, this is very important, has responsibilities. Okay, mainly lot of employees or all employees will have responsibilities. Okay, only management representative will have responsibilities and authorities. Okay, sometimes QA, head of QA could also have authorities. Okay, but he has to work in tandem with MR. But basically, MR will have maximum authorities. So, responsibilities, what is the difference between responsibilities and authorities? Of course, it is not there here.
Sir, in our company organization, uh, like management review, like particular person is not assigned for the QMS. So during audit, one team had like QA head lead, like CQA lead, QC, production. All people on one member will come to the lab. They will give the training, like explanation of the work culture. In documentation, the way like senior level, like manager level, in person discussion only, like lab visit senior manager they will handle, like documentation verification during audit, like assistant manager, deputy manager they will handle. But not only particular QMS person is not also sir. One team like CQA, uh, AQA team are there. CFT team one person will come to the in discussion person with auditor.
Yeah, that's what I said. It depends from companies to companies.
So,
Some companies have a very vigilant, very strict on that. Some work very informally. Okay, don't follow the regulations. Okay,
okay.
but for me, management representative is a very important post. But very in a lot of companies, management representative is like a rubber stamp. Okay, he
Yes.
doesn't know anything. He is like just president of India.
Yes, yes, sir. We feel it saw some of people. So
Okay, I don't know what president of India does. Till today, I don't know what are his the duties of president of India. He's
they
just
even
like,
know scratch down level work they don't know, but they are uh, like treating like something different way, like the way of
yeah, here
behavior.
MR also, he doesn't know what are his duties, responsibilities, but forget about what is duties, responsibilities, whoever it is. But for us, it is important to know as per 13485, there
Yes.
will be responsibilities and authorities to a management representative. Okay.
Yes. Uh,
See, responsibilities are his daily activities.
okay.
Okay, management representative, he will be an employee, like he could be, I said, head of QA or head of RA or head of something. So his daily activities will be there. That are his responsibilities. See, authorities are very different. Okay, authority is something very powerful word. Powerful word means authority is he can take some important decisions in the absence of management.
Yes, sir. Mm.
Okay, suppose if there is something happening, some generator or some fire mischief happens, okay, in the company, without informing to the management, he can say that today we are closing the company. He has the authority. Okay, and he can dispatch or he can recall the products. Okay, with consultation with head of QA. Okay, after discussing with head of QA, he can recall any number of batches of products. Okay, that is an authority. Okay, he can have authority. Okay, if there is any mischief that happens with the employees in the company, some nuisance or nonsense, he can issue memos. He cannot terminate, but he can issue memos. Okay, and also something like on emergency without telling to head of QA, generally who will sign the dispatches, he can on emergency, he
Yes.
can dispatch, he can dispatch the stock or finished goods on emergency if it is required. So there will be some authorities where he can use it in
Supervise.
emergency when there is when management is not available or can't reach the management. Okay. But once the management comes back, he needs to inform what all he has done. So this is so when you write MR appointment letter, okay, when MR appointment letter is written, the important thing is in MR appointment letter, there will be separate, you need to write separate responsibilities and what are his authorities.
Yes, sir.
Okay, I'll share one appointment letter of the MR of my company where I worked some time back. But I was never MR, like I hate that post.
Yes.
Okay, then this is very, very important management review or what we call MRM, management review meetings. The management review is the mandatory health check, okay, of the QMS. Why I say this is important means during the management review meetings, we will be the management and the team of HODs or the employees will discuss lot of things and the management will try to understand what is the health of the QMS, whether it is in ICU critical or is it healthy, is it doing well or it still needs some medication or still needs some treatment, okay, or how we should make it move further and further improvements can happen. So this is very critical regarding the management. But I know like many managements don't conduct management review. Only the head QA or some people will write it
Yes.
manually that we have conducted management review, these decisions are taken, this is the outcome, this is the minutes of the meeting on that day we conducted. I know like many very good companies don't conduct management reviews. The reason is in the management review, there will be some very bitter information that will come out. Very bitter information that will come from the employees. Like say they will give only one machine, they'll ask us to work in 3 shifts, and the machine won't be working properly. There won't be any spares. Okay, if you keep telling this to management, no, they get irritated.
Yes.
Okay, like this, if we ask for more manpower, they say like, no, 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 we can't have more manpower. You manage with the same manpower. When we say with the same manpower, our rejection rates will increase. Then they'll say, you try work extra hours, we'll pay. I mean, it's like working extra hours will reduce the efficiency of the employees. They may pay OT or overtime, they may pay extra money, all that. But overtime is not advised as per Companies Act.
Yes.
Okay. It's like, say, what happened, uh, 1 year back, many times it happens, but that is very risky. Like you have seen plane crashes happening mainly with this Indigo. Indigo pilots, they work overtime.
Yes, sir.
So when they work overtime, no, and that too at high altitudes, okay, sometimes your brain won't work.
Yes, sir.
So there is a very high risk of accidents, or when they are landing or when there is takeover, there could be a lot of mistakes that can happen.
Yes,
And a
over
lot
time.
of, yeah, plane crashes are because of overtime. Okay, and Indigo manages that well, but that is very high risk case. Even in
Yes,
some medical ways also there will be high risk implants, like uh, suppose somebody is doing QC of an heart valve or a stent, because he is stressed out, a rejected one also he says it's accepted, and that goes to the patient and the patient will suffer because it's an implant life saving device. Okay, that's why management reviews has to be conducted at planned intervals based on the company QMS. The QMS is worst, not functioning properly. Every month they can conduct. If it is okay, good, every 3 months. Okay, if it is really good, not a big issue, well established organization, every 6 months. Or if there is multiple plants, verticals in different countries. Okay, yearly online they can conduct. So a lot of things can happen. So in management review meetings, it is not a general chat like 10-15 people gather, have coffee, tea, and go. Very important issues will be discussed. Okay. Mainly, what are the issues? These are called input data. What are the topics that will be discussed? Audit
yes,
results, internal and external audits. What are the audits happened? What are the NCs? Okay, when we are closing the NCs, what are the potential NCs, major NCs? Okay, all that. When are the next audits? All this will be discussed because, as we discussed, internal external audits tells a lot about the effectiveness of QMS and health of QMS. And we also discuss like complaints, feedbacks. It also has to be discussed. What are the complaints? What are the serious or serious adverse events? Okay, how you handle them. Are there any recurring complaints? Same complaints though you have done CAPA, which means very bad. Suppose you have done correction, you have done preventive action for the complaint, and still the complaint happens again and again, which means your CAPA is not effective. Okay, your correction, what you have done is not proper, effective. Okay, then the process performance, what is the production yield, rejection rates, all that. Are we meeting our objectives, quality objectives, product conformity, how many products are failing or passing the final test reports. Okay, that's a final QC. What is the COPA? How is occurring? This is what analysis of reoccurrence. If there is a reoccurrence of the same complaint, this is very bad. You'll have a major NC. Okay, are we closing the
Yes.
complaints on time, COPA on time, follow-up actions? Okay, follow-up means previous review management review meeting, what we have discussed, have we completed what we have discussed last time? Okay, that is follow-up, because
Yes.
every review meeting that has been discussed, you need to have follow-up. Just it's not like meeting and writing something and leaving it in the file or dustbin. Okay, and what are the recommendations? What are the challenges? Okay, like should we go for new supplier or new machines? Okay, or changes infrastructure we need to have separately for microbiology and QC separately. So all these things, sterilization, okay. Recommendations for improvement, should we take new employees, who are the new customers we can attract? Okay, a lot of things will be discussed based on the company. Okay, I can write hundreds of them, what can be discussed in management review. And after discussion, there should be a review output. Suppose I discuss complaints. There are so many complaints, so and so. So, regarding the complaints, what you are going to do? Are you going to reduce the complaints, or the complaints will remain the same? What is the timeline if you are want to reduce the complaints? That is the output.
Yes.
Okay, if I say I'm trying to improve the product, what improvements you are doing so that patient safety is addressed? What are the timelines? Resource needs. Suppose I need 10 employees. When you are appointing, in which departments appointing, what are the timelines? So these are the outputs. Okay, I'll share one MRM inputs and outputs document.
Yes, sir.
Okay, you can go through that and you'll understand it better. So these are our practical scenarios. You can go through that in quality. Our real world cases, like how you write it. Okay, like quality policy, organization roles, plans. When you are practically implementing them in the shop floor, you need all this. What are quality objectives? How you need to
Yes.
write it. Yeah. Responsibility, communication, management, authoritative. Okay, these are auditor's checklists. What questions the auditor will ask? Clause by clause, I have given sub-clause. In quality policy, these are the questions the auditors will ask. This will be useful for even in your internal audits.
Yes.
Okay, you can ask these questions during your internal audit. Okay,
Okay.
so with this,
Yes.
we'll stop clause 5 and you go to lunch.
Okay, sir.
Okay, you come back very quickly. We complete clause 6. Clause 6 is not so big
Yes, sir.
and it is easy to understand. Okay,
Okay, sir.
go to lunch and come back.
Okay, sir. What time will start now?
Yeah, come back. How much time it will take for you?
It's like half an hour I'll come, sir. But
Yeah,
half an hour.
come back at 2:10 or 2:15.
Sure, sir. Sure. Okay.
Right, bye.
Okay. Thank you.
Yeah.
Hi, sir.
Mm. Yeah, Venkatesh, had your lunch?
Hi, yes, I had, sir. Yours?
Yeah. How was your
Yes, sir.
how will be lunch in your PG?
I mean,
In PG, how your lunch will be?
it's not good, sir. Like, it's daily afternoon only rice they will give. Like,
Mhm.
Evening they will give, even though chapati, some curry. Due to some LPG issue, again he also reduced. Again evening also he'll give chapati rice only.
Acha, because of LPG costs.
LPG cost. Basically, he won't do that much. Now it's happening LPG issue. So like he
It's
not doing.
almost like commercial LPG is something like 2,700, I think.
Yes, sir, it's happening. Commercial, but they are sending black sometimes 3,000.
Yeah, yeah, black you need to get for more.
Yes, sir, yes, sir. But these people, I don't know. He told 3,000 I'll get three, like he's telling owner. But anyway, he like a lot of things he reduced in food from past 1 2 months. Only doing rice and single item for morning. And now power is shut down, sir. There is no morning onwards. Even my laptop also 20% later. I will join by phone. I think phone charging also less. 30 40% is there. Morning hours power is not there here also.
Acha.
Early morning I kept both charging. So around
It was
11 o'clock.
raining yesterday. Yesterday night there is rain.
Yes, yeah. Sir, Friday like one to one discussion is there. So like one he is like JD mentioned like in telephonic he asked like some of related to ISO 9001.
Mm.
So I mentioned I'm working on that present in company 13485. So I'm aware of, but I've told them like, sir, this both are similar only. It's a general quality management system. This is a specifically medical device. I told okay, okay. So he told like in-person discussion is go on Friday evening.
See, I
Uh,
have shared one document on that. ISO 13485 versus 9001. Yesterday I
okay,
shared. You
okay,
go through that. Okay,
okay,
if you have any doubts, just call me.
okay, okay.
Okay, in that.
No, so what may they will ask you? May any key points like 9,001 or
No, not key. What is the basic difference they ask? And say, as I said, no, in 13485, we have risk-based approach.
okay,
In 9001, there won't be any risk-based approach. And we have product life cycle approach in 13485.
huh.
In 9000, you don't have product life cycle. Okay, and but both there will be documentation.
Okay,
Okay, and class 8 won't be there, like uh, complaint handling or internal
only three are there.
audits.
Yes.
Yeah. So for us, PMS, they won't have PMS.
Okay.
Maybe there's some they will have customer feedback, but we'll have extensive PMS like PSU or all that complaint handling.
Yes.
We have detailed procedure. You go through the document, you'll understand.
Sure.
For us, for us, patient safety is important.
Huh.
For
Customer
them,
service.
customer satisfaction. Yeah.
Yes.
Just
And
let's please. Yeah.
sir, like 2700 also like it's indicates auditing internal or external. Is it similar to here? What's going internal? That is completely different from there.
Which one?
ISO 27001, like lead auditor, something it's
No,
they are
it will be same like internal auditor.
okay. Okay.